Today we are going to demonstrate the use of an innovative device developed at the University of Texas Medical Branch by a small company, Prospiria. 25 million endotracheal tubes are placed every year in the United States. 2 million of these are placed in critically ill adults and children. Life-threatening issues associated with inaccurate endotracheal tube positioning, including too deep positioning, in which case only one lung might be ventilated, and too shallow positioning, which predisposes the endotracheal tube to accidental removal or to vocal cord injury. Of the human trachea from approximately the vocal cords, which are about here, down to the end of the trachea where it divides into the right and left mainstem bronchi, is about 4 to 6 inches. In the top diagram, we have a properly positioned endotracheal tube in which the endotracheal tube cuff is completely beneath the vocal cords. The endotracheal tube tip is above the carina, that is, the division of the trachea into the right and left mainstem bronchi. So the cords are not compressed by the cuff and both lungs are ventilated. In the bottom diagram, we see an improperly positioned endotracheal tube in which the endotracheal tube tip is beneath the carina. So the cords are still not compressed by the cuff, but only one lung is ventilated, and that can result in the kind of problem we see in this child's X-ray in which the left lung is completely collapsed. By inserting an optical fiber through the endotracheal tube, the pulsed laser diode generates an acoustic signal that I detect using this acoustic probe. My peak signal is right at about the cricoid, and I'm directly over what would anatomically be the proper location of the top of the endotracheal tube cuff. If I move the probe toward the chin, the signal diminishes and within a half an inch is virtually gone. In only a few seconds, we have confirmed proper positioning of the endotracheal tube. It has not required any additional diagnostic studies, such as chest radiography.